So you believe that you can live a normal life now?
Yes.
Kathy Bennett has lived with an HIV infection for 21 years. Her outlook was bleak back in 1990 when she was first diagnosed with acquired immune deficiency syndrome, and her doctor began treating her with drugs that proved too toxic. He stopped and told her to go home.
I laid in the bed for 4 months waiting to die because he told me, he said, I can't treat anything.
But after she began treatments with a new class of drugs, Bennett's life changed, and now she's doing well and is a treatment counselor for AIDS patients.
I don't look at this virus now that they know how to manage it as a death sentence. I'm living a normal life. I expect to be around a lot longer.
Despite the availability of antiretroviral drug treatment, in 2009, about 2.6 million people were newly infected with HIV, and 1.8 million people died of AIDS. But 30 years ago, the medical community was full of pessimism. Dr. Anthony Fauci, then a physician trying to treat patients suffering with this new disease, vividly remembers those days. He is now director of National Institute of Infectious Diseases.
We had no idea what that infectious disease was. And then in a very rapid succession, many people started getting really very sick and dying. So it was a very disturbing, dark period of time where you didn't even know what was the cause of it.
Slowly, medical experts gained a better understanding of the infection. It became clear a weakened immune system caused the condition. It also seemed to be sexually transmitted. Dr. Robert Gallo is the co-discoverer of the human immunodeficiency virus, HIV.
It's not a moment. It's not a eureka. It's not like, oh, now I see that's the cause of AIDS. I tried to describe it to someone before. It's like peeling an onion. You know, you're getting step by step to get to the center, which is, this is the cause.
But there were still no drugs or vaccines to combat the virus, and many experts were pessimistic. Then came a breakthrough in 1987 with the first approved drug, AZT.
The virus could be dropped. You could measure it and see it go down, and even though the drug was toxic, the AIDS-related signs and symptoms were disappearing. So, wow.
Hopes faded when HIV became resistant to AZT. But then in the 1990s, effective combination drugs were developed, and they have become the most potent weapon in the effort to battle HIV.
The cocktail, as they called it, did we dramatically turn around the lives of HIV-infected individuals by giving them the opportunity to live essentially a normal life with good treatments.
But AIDS patients say they continue to battle the social stigma attached to the disease.
It was a lot of stigma then, and it's still a lot of stigma now.
Beyond treatment, the other major challenge is checking the spread of HIV. The risk of transmission remains high among people under 30. And at the Elizabeth Glaser Pediatric AIDS Foundation, the focus is on protecting infants and young children from infection. Dr. R.J. Simons, the foundation's vice president, says progress has been made, especially in developing countries.
Mothers who were identified as being HIV infected during their pregnancy could take a medication that could then prevent their baby from becoming HIV infected.
But a UN health report says the fight against AIDS is far from won, and the costs are unsustainable. Next week at the United Nations, 30 heads of state will meet to review the considerable progress that's been made in combating AIDS and chart the future course of trying to treat it.